Good morning, ladies and gents. Today we're getting into the conversation around breast cancer. Given that it's October and this is a month where we try and revive that conversation that sometimes goes quiet throughout the rest of the year, although it should still be happening, but we try and bring it to the forefront, okay? So that's what we're talking about today. And here's a quick fact before I even introduce the two lovely ladies with me today. And that is, a woman has about a 1 in 8 chance of being diagnosed with breast cancer in her lifetime. So the truth of the matter is there's a likelihood that you may know someone, be related to someone, work with someone, or have birthed someone who might be affected by breast cancer at some point in their life. So please listen up, because we're also going to discuss some of the things that you should be doing or shouldn't be doing. But for now, let me start by introducing our guests. We've got Dr. Gladwell Kiarie, who's an oncologist at Mpisha Hospital. And we also have Magdalene Mbugua, who is the current principal at Loreto Convent Msongari and is a breast cancer survivor. Ladies, welcome to the show.
Thank you.
I love that we're all in prints. Really bold ones in our own way. It's like we came to pack a punch for the show. Maybe we could start with you, Magdalene. How are you feeling today?
I feel great.
Yeah,
and happy to be here.
Okay. And physically too, are you feeling?
Yes.
Okay, perfect.
In top shape.
Okay, good. Can you take me to the moment when you were first diagnosed with breast cancer, and maybe even leading up to that, if there were any symptoms or signs that had shown up?
Actually, for me, I didn't experience anything. I was up and about, doing my job, doing my things, and there was no sign. I didn't get to experience anything until one time when I felt like I'm a bit constricted. I felt a bit tight.
Where?
Around, actually it was around the breast area.
Okay.
And I told myself, oh, maybe I'm growing fat until my bra is squashing me or something. And then something just told me to just do a breast examination. I felt a lump.
I'm curious about the constriction, because I've never heard it described like that. Can you explain that a little bit more? Is it that you felt a tightness even when you weren't wearing a bra? I've never heard that.
Actually, I didn't notice, but now I know it's because it has gone to the lymph node. So I think that is what was making me feel a bit tight. And it just felt like one day. It's not that something I was experiencing and ignoring or something. No, just that evening. Actually, I was just about to get to the shower and I felt like I'm a bit constricted. Okay. So when I examined myself, I felt the lump.
So you did a self-examination?
Yes, I did, and I actually felt a lump, and quite a big lump, and I was really, shocked about it. I'd not felt it before. So the following day, I actually went to Aga Khan to see a doctor. Yes.
And did you have any health scares before then? Any major health scares, or was this the first?
None at all. I'm one of those people who don't even go to hospital. Just a common cold that I'll take some ginger, honey, lemon,
and you're good to go.
Yes.
And this was in 2016?
2016.
Okay.
October, actually.
Yeah. Dr. Kiarie, October, so it was actually exactly two years ago.
Yep.
Doctor, is that a common thing, that feeling of the restriction?
Not really common, because probably the commonest thing is to feel nothing, as Magdalene has said.
Okay.
And the awareness we should create is that women should not wait to feel something.
Okay.
Most of the time you feel nothing.
Yeah.
But as the size of the lump increases, you'll get a bit of heaviness. And when there is involvement of the lymph nodes because of the lymphatic infiltration, what happens is that it tethers on some of the tissue around the arm.
Okay.
And when it tethers with a bit of movement and tethering also to the muscle of the chest wall, you may feel a bit constricted, as if you're trying to move your arm, but there's something holding on to it. And probably that's the feeling that Magdalene describes.
Oh, is that it? That you were trying to move and you...
Yes, not really in the movement.
Yeah.
Just
a bit of a bit of discomfort, kind of.
Just ordinary sort of, you feel that you're a bit constricted.
Yeah.
You expected to be easy
Yeah.
and comfortable, but you felt as if there's something, you know.
Okay,
right.
Yes.
yeah. So Magdalene, when you then felt it and the next day you decide to go to the doctors, did you think that this might be breast cancer, or were you still, you know?
Actually, I panicked.
Okay.
Because now, you know, when you hear of a lump on the breast, the
Yeah.
first thing comes into your mind
Yeah.
is breast
Yeah,
cancer.
yeah.
And that's why I just went immediately the next morning.
Yeah.
Yes, so I went to the doctor
Yeah.
and they asked me to do a mammogram.
Okay.
So I did the mammogram, and then I was sent now to the breast surgeon at Aga Khan, Dr. Wasike. So when I went to see him, he told me we needed to do a biopsy. So I went, did the biopsy, went back to the doctor, and that's when now he broke the news to me. Yeah.
Do you remember that moment?
Oh yeah,
And
vividly.
Yeah. Well, so what was that like? Can you take me through that?
Wow, it was really okay. I can say when all this was happening, I somehow had gone through in my mind. I had gone all the way. I told myself it could be this, it could be that. So I thought I was okay, even when I went to see the doctor. So the doctor explained and told me this with you know, big words. So I asked the doctor, so can you just tell me exactly? He said, I'm coming to that. So finally he just broke the news.
Yeah.
I was there with my sister. It was shocking.
Yeah.
Much as I'd taken my mind through it, it could be that,
Yeah.
that way. It was very shocking and very devastating.
Yeah.
And what quickly came to my mind was, so what's next? How can I get out of this? So actually the only question I asked the doctor, so what do I need to do? That's all I asked him.
Right. And what was the exact diagnosis?
It was breast cancer, and he told me I was at stage 2.
Stage 2.
Yes.
Okay. So, Dr. Kiarie, in that case, how often should we be checking for any lumps? Because in my mind, I thought once a year is good enough.
No, that's not adequate at all.
Yeah.
It's very important to feel your breasts thoroughly once a month. And we usually recommend that after your menstrual period, when the breasts are less heavy and contain less fluid content because of the premenstrual tension, check your breasts and you're able to feel for lumps very well. Now, the more often you do it, the more likely you are to notice a difference between 1 month to the other. It should be a very sort of routine thing after your periods, just to have a feel of the breasts.
Right.
Especially for anyone over the age of 30 years.
Yeah.
Now, also, you know, Magdalene has told us, you know, when most people feel healthy, they don't see the doctor or see the need to see the doctor. And not only for breast cancer, but the other non-communicable diseases that have come up quite a bit in our society, it's very important to have an annual health check if you're healthy. So when you see the doctor annually, have him or her also examine your breasts, and by all means have the routine screenings that are recommended.
Right. Okay.
Yes.
But quick tip, it should be every month right after your period. Just do a quick self-exam.
Yes.
And really pay attention to your body.
Yes.
So back to you, Magdalene. When you now are asking the doctor, okay, what next? What can I do now? His response was?
So he assured me that this is doable. I should not worry.
Yeah.
I'll get treatment and I should be able to lead a normal life.
Yeah.
So he actually told me what I need to do. I need to do a scan.
Okay.
To actually know the stage I am at.
Yeah.
But when he actually told me, and you're not at stage 1. So that actually, I panicked at that moment because I didn't know it could be 2, 3, 4.
Yeah.
I could be told I have 6 months to live.
Yeah.
So I just went and booked the scan and came back the following day so that I could have the scan. So I had the scan and I went back now to him. And that's when now he said we need to now look for an oncologist and start now the process.
Okay.
Yes.
What were the treatment options that you were presented with?
Okay. So he said that for me, I would need to do chemotherapy first.
Yeah.
To try and shrink the tumor, I mean the lump.
Yeah.
Then from there, I need to do surgery and then do radio. Then he said, when I get to the oncologist, now he's going to give me the whole plan on what I need to do.
Dr. Kiarie, is that usually how it goes? That there's chemo, radiotherapy, surgery?
Now that would, you know, the sequence varies from individual to individual based on your stage of disease and probably even your comorbidities. And those are other related health problems that determine what treatment you can withstand. So in Magdalene's case, because she had a lump under the arm, it might have been, you know, big enough for the surgeon to think that he may not get very clear margins if he operated first. And surgery really is very important in the cure of breast cancer. And the importance is to get all the tumor out with very clear margins. And a clear margin means a good distance between the end of the tumor to the margin where the surgeon's knife cut. And you see, sometimes it's not what you can see macroscopically. Tumor actually has blood vessels and lymphatics that feed it that may not be very obvious to the naked eye. So the surgeon needs to conceptualize where he will cut so that he completely gets it out with all its quote unquote its roots.
So I can only imagine.
The concept is to give treatment first and shrink it, because smaller things are usually easier to remove.
And I can only imagine what that was on you physically, how it must have taken a toll on you.
Yes, because at that moment he told me there were options. I could have just a part of it, I mean, just remove the lump, or have the mastectomy, that the whole breast will be out. But he said that the oncologist will be able to now explain and let me know what exactly would be my kind of treatment.
Well, we have to take a quick break, but when we come back, we'll be joined by a different doctor. That's Dr. Philip, who I'll introduce in the next segment. And Dr. Kiarie will join us much later in the last segment, just to give us some more tips on how to make sure that we are doing everything that we can to prevent ourselves from getting this disease. But we'll be back in a moment with Magdalene and Dr. Philip. Welcome back, ladies and gents. We're talking about breast cancer, given that this is October, and our guest today is a breast cancer survivor. That's Magdalene Mbugua. But right now we're joined by Philip Odiyo, who's a psycho-oncologist. That's what he studied, and he's the patient support manager at Faraja Cancer Support Trust. Welcome, Philip.
Thank you.
So in the first section, we delved mostly into the physical aspect of it, the treatment options that you got, and even just how you discovered Magdalene. But I can only imagine how this must have also taken a toll on you, mentally and spiritually too. Can you talk to me about that?
Okay. When one is maybe threatened, life is threatened, it's very devastating. So of course, when I was told I have breast cancer, it was very devastating and filled with a lot of fear. Will I make it? What happens? My job, my children, etc. And you go through a whole set of emotions and confusion. So what do I do? Where do I go next? Do I seek a second opinion? Which hospital should I go to? And all these things. So all this, you're just bombarded with a lot of emotion. And it's really, really a stressful moment.
Oh, wow. And did you seek out any kind of therapy or maybe a support group during that time?
Not formally therapy. Okay, during that time, somebody just put me in a group, this Limau Cancer Support Group. And in that group, people give their experiences, share experiences. People encourage each other. When you're one step, let's say you finished chemo and we are all celebrating, we would also have some doctors on board and we would ask all the questions and we would get questions, and that really helped. And then at the same time, I also joined together with Outburst for the Boot Cancer Challenge.
Okay.
This is just a family fun-filled event.
Yeah.
That just creates awareness, promoting health, eating healthy, advocating for screening,
Okay.
and just giving hope to in this fight of cancer.
Right. Philip, how important is it for patients to join groups or seek out that sense of community from people who are going through the same thing, or even seeking out therapy?
I think I'll go back to the first experience that Margaret had after the diagnosis. The first thing she said,
Magdalene.
Magdalene, sorry. She mentioned that she was bombarded with a lot of information, and there was confusion and a lot of things, you know, emotional upheaval, wondering, you know, what's going to happen to me, how long do I have to live, my kids, and then my job. So I think that's the first reaction that most of the cancer patients have, which is basically what we call existential crisis. So every patient has a different experience. So for example, in Magdalene's case, I will not even be quick to push her into support group because she's still dealing with the diagnosis. So it'll be to calm her down because she said there's shock and panic. So helping her, you know, internalize that and deal with it before we move her into the next phase. Yes.
Okay. What was your family's response like?
It was shocking for everybody because you see, I have been one of those people who don't go to hospital. I've been healthy, and then all of a sudden I have cancer. So it was really a shocker, and so many things had to change in the family setting.
Right. And how did you find support?
Wow, I can say I had great support from my family. That's my husband, my children, sisters, my parents, and that really worked for me. It really gave me hope. They were there. They would let's say, like when I needed to go for chemotherapies or radio, they would accompany me. They would be at home to help with some of the chores. I don't have to do the cooking and all the other things, so they would be there to do the
Were you also still working?
Yes, I was.
Wow.
I worked all through. I was only away like that week after chemo. You know, with all the side effects. You know, that would weigh me down and put me down, so I was not able to work. But after that 1 week, the next 2 weeks I was in school teaching. Wait for the other cycle. Go do my chemo again. Then 1 week down, then I
what a
get back.
Yes. Philip, what are some of the ways that that family and friends can really show up for someone who's been given any kind of diagnosis?
I think one of the things is also to identify the patient, because the way people deal with cancer diagnosis is different. So for example, there are those who would want some family to support them. And I think for the family members, it's also a shock and confusion. So what is important is for the family to find out from the patient, how can we be able to support you through this journey? So there are those who will need practical support, for example, picking, dropping them to the hospital. And then there are those who will need financial assistance. You know, their bills are paid for, so they don't have to worry or call for Harambes. And then there are those who are also trying to deal with this diagnosis. So it's also important for the family members to be there and deal with these issues, support them through the process. There's something else that she said. She was continued working, and I was just sharing with her that that is very important when you are somebody who is employed and you've been diagnosed with cancer. It's really important for you, if you can, to continue working, because working gives you some sense of stability and also helps you to forget about all these worries about cancer. So I find that those who continue working actually heal faster than those who take time off and you know, go back to work later.
Wow.
Yes.
Wow.
Yeah.
Did you ever have moments where you just thought, enough is enough, I'm tired, I've had it? Did you ever have that struggle?
Of course, I had my low moments, but I think for me what really was key is to get well. I couldn't wait to get back to who I was and who I am. So I kept pushing it. I didn't allow anything to bring me down. I did not. Even after chemos and I was down, yes, I would not go to work. I never stayed in bed.
So what is it?
I never stayed in bed. I was in the sitting room. I read, I
Yeah.
prayed.
Okay.
I would have friends coming around and we would really chat and etc. So I kept on saying, when will this thing be over? I'm trying to fight it and I want to get back to myself.
Yeah.
So I never allowed myself to really, tell myself, oh, this is it, I can't make it, I can't move on. No.
Yeah.
No.
Philip, is
Yeah.
that awareness
Yeah.
and that kind of mental fight? Because physically I know you're also fighting this,
Yes.
you know, but is that mental fight
Maybe I can say
important?
something.
Yes, yes.
My doctor told me cancer is curable, but your mental state will actually determine where it goes. And once he told me that, I hung on to it.
Wow.
I hung on to it.
I literally have goosebumps right now. That it's almost, there needs to be a mental
yes.
shift. And that if you allow yourself to be the victim, the weak,
Yes,
that
that won't work.
Yeah. That you need to. So, Philip, can you take
Yeah.
us through that? Like, what are some of the things that, if someone is going through this right now, any kind of serious diagnosis, and are struggling to fight mentally and are feeling like, you know what, I just, there's no hope. What would you tell them? How do they keep that fight alive?
Like she said, cancer is also a mental disease. Whatever you have, you put yourself in, I think you'll be able to beat it. So if you have that fighting spirit, which not everyone has, that will really help you. But we also have to look at people individually, because her case might be different from someone else who is really feeling defeated and down and needs support. And maybe they don't have that fighting spirit. If you have it, well and good. If you don't, then it's really important to seek support from those who can help you, whether it's family, whether it's church, or whether it's friends.
Yeah.
Don't close yourself in.
Okay,
Yes.
that's a good tip. So
Yes.
what's another good tip to build that muscle, to start feeling like I can do this, I'm coming out of this, I'm going to win?
Yeah, the other tip I give to the patients is to encourage them. I connect them with the survivors, those who have gone through the process. That is very helpful because they see that person who has been a survivor for 2 years, 10 years, 6 years. Then it gives them some sense of hope. That,
Yeah.
they were like me and now they are doing okay.
Yeah.
So that is an encouragement to them. Yes, yeah.
Did you find
yes, I can
that
identify
helpful?
with that.
Yeah.
Yeah.
Anytime I saw somebody who says they are victors, this is my 3rd year, this is my 10th, that really gave me the hope.
Yeah.
So I totally agree with what
Wow.
he's saying.
Yeah.
Yeah, when you see these people and you engage with them
Yeah.
and they tell you, yes, I was there and I made it, that really is a good motivation.
Yeah.
Yep.
Yeah.
How has this journey changed your life?
Wow, in many ways. It has. First of all, I've changed my lifestyle totally.
How
in
so?
terms of eating, especially.
Are there specific things you've done?
Yes, I have made deliberate efforts
Yeah.
to change my eating habits.
Like what?
Like, I used to be a very sweet tooth. I had a sweet tooth, and these days, those cakes, those chocolates, I just do away with them. Okay, if I went for a party or a birthday, I'll take a piece, but I really don't buy them anymore in my house. Then the kind of cooking, I have stopped using the spices. I use sea salt to cook. I use olive oil to cook. I make, the choice of meal. I have to have vegetables. I have to have a fruit. I have to have a complete balanced diet. Every time I'm eating, I avoid the sugars.
Yeah.
And some fruits that I never used to really even care much about.
Yeah.
Now I find myself,
Like what fruits?
This sosop. It's, yes.
What fruit?
The what do you call it? The castor apple.
Oh.
Yes, like the castor apple.
Oh.
I did.
Okay,
Yes,
okay.
I take that.
Wow. Yeah.
Yes,
so it's
so-
complete diet shift, dietary
Yes,
shift.
I do a lot of juicing. I
Okay.
do, like, every morning. I
Wow.
have to do the beetroot, carrot, apple.
Yeah.
And,
Well, that's
and
a good. That's a good way to
cucumber.
start the day.
Yes,
So
I have to do that.
and mentally, has there been a shift?
Yes, of course. I just realized, it's like you've been given a new lease of life. So I find myself more having an attitude of gratitude, that it's a new day and I have an opportunity to do so much. And I've also really invested a lot in people, because when I was down, actually people really made a difference in my life. So if I hear my friend of mine is down or unwell, I will want to just support them, go there.
Okay.
Yes.
And Philip, before we go on break, what are some healthy habits that people can pick up from, and not like when it comes to diet, but like mentally and spiritually, whether it's the people around the patients or the patients themselves? What can they pick up to make sure that they are constantly coming out as victors?
As victors. Before I answer that question, I want to go back to the dietary issue, and it's a challenge that sometimes we face with the patients who are on treatment. Mostly those who are on chemotherapy treatment. I think before somebody begins to restrict themselves to diet, it's important that they consult their nutritionist, because when you're going through chemotherapy, you need to eat as much as you can.
That's true.
So that's a caveat that I wanted to put on that.
Okay.
One of the the other ways that I think patients can deal with this is to connect. Like she said, there's connection, family issues. You know, how can you be able to connect with your family? Because you've been given a second lease of life. There are things to do with physical exercises. Are you able to exercise? If you're not exercising before, it's really good to keep that up, you know. And then also read, you know, have more information. Because what I notice with the survivors is they almost become advocates, like teachers. So you need to have that information, one, for you, and then number two, also for people who will be consulting you. And the last one is you need to know your body as a survivor. Because what do I mean by knowing your body? There's always a fear of recurrence, which affects many cancer survivors. So they need to constantly keep updated with what's happening in their body, keep up their doctor's appointments and the medications.
And the fighting mentality too, that no matter what, even if it happens, you're still going to win. You're going to come out of this the victor. Wow. Okay. Well, thank you. Thanks, Philip, and thank you so much, Magdalene.
Welcome.
Now, in the next segment, we're going to go back into the conversation with Dr. Kiarie, and we're going to go into her office, and we will dive into, well, first we'll even give like ourselves, we'll be told how exactly to do a self-examination, but also we'll dive into some of the things that we should or shouldn't be doing when it comes to breast cancer awareness and prevention. Remember, October is Breast Cancer Awareness Month. And so if you can educate yourself and learn about this, and hopefully in doing so, be able to prevent yourself from getting this disease or pick it up quite early, then the better, right? Because ultimately prevention is better than cure. And when you know better, you do better. But for now, we're going to go on a quick break and then come back with Dr. Kiarie. Welcome back, ladies and gents. It's a new day and we're finally at Dr. Gladwell Kiarie's office. That's at the Nairobi Hospital. And we're about to now understand some more further insights into how to make sure that we are living our best lives, but also how to make sure that you're able to check for cancer if you've never been able to. She's going to tell us everything. Now, first question to you, doctor, is are there certain groups of people that are more at risk of getting breast cancer?
Yes and no. Majority of breast cancer actually occurs from spontaneous mutations. So you don't have any identifiable medical risk, but you do develop a breast cancer from a spontaneous mutation. Okay. But there are groups who have family history of breast cancer, especially first-degree relatives, and they are predisposed to a certain higher degree to get breast cancer. There are inherited mutations, for example, what we call the breast cancer gene, BRCA1 and BRCA2 genes. Okay. And one of the most famous people with such a gene is Angelina Jolie. So it predisposes them to getting breast and ovarian cancer.
That's why she had the mastectomy to make
so
sure.
in her lifetime, she had an 85% risk of developing breast cancer and 60% risk of developing ovarian cancer. So she's lost several family members to the disease, and therefore she chose to have both her breasts removed as well as her ovaries. So genetic mutations, not very common, but they do happen. And sometimes they predispose the same individual to getting two cancers. So you can get ovarian cancer and then later get breast cancer. Then there are other risks, individual risks, for example, what we call hormonal factors. We know that prolonged use of oral contraceptives usually portend a certain risk, but we tend to think that this may be additive to another risk for a lady to get breast cancer from the use of that. There are traditional factors that were described that women without children, women who got a delayed menopause or early menarche would get breast cancer.
Early menarche,
getting your periods is early, predisposed due to a long hormonal exposure, and therefore an exposure to breast cancer, especially if you are nulliparous, you never got any children. Now, I must comment that we are seeing less and less of those traditional risk factors, especially in Afro-Americans and also in some of our African groups.
Why is that?
Now, very interesting, because we also see certain age-related differences between those who are best studied in Caucasians, and then as more of, you'd call the minority groups are studied, some of these differences are actually noted. But I always like to caution that people must be very sensitive to their own individuality, in that you don't have to have these risk factors to have breast cancer. Then we also talk about women who've had previous radiation. If you've been radiated for thyroid cancer, for lung cancer, you may get a breast cancer. Women who have had other, other pre-malignant breast lesions, like people who get fibrocystic breast disease, who have had surgery for previous lumps and so on, may develop a breast cancer. And of course, we talk about the other risk factors like being overweight, especially postmenopausal obesity, smoking. We talk a little about alcohol, and the list goes on and on.
So those are the risk factors. Now, how old, or what's the age of the youngest patient that you've ever treated for breast cancer?
Now, I've treated patients in their 20s, and in our cancer registry, the Kenya Medical Research Institute and Global Cancer Registry has recorded 5 patients who are between 15 and 19 years with breast cancer, which is quite unusual in global data. That is unusual.
Okay. Would you say that that cancer is affecting younger and younger people, or is that not?
I would say that in our, in Africans, as has been noted in Afro-Americans, the age groups tend to be a little younger than was described among Caucasians. Now, if you read older literature, you find that breast cancer was higher in postmenopausal women. When you look at some of the data we have, breast cancer is higher in premenopausal women.
Wow. Okay. So on that note, how old should we be when we go in for our first checkup?
I think on a general sort of overview, women from the age of 40s should begin having a self-breast examination after their periods every month, and they should have their annual check with their doctor, have a doctor examine their breast. Now, depending on their individual risk, do they have a family member with breast cancer? Have they had a previous lump? Do they have a known genetic mutation? Do they have another increased risk that I mentioned? Then the index of them being screened should be a little higher. But from the age of 40, self-breast examination, a doctor's examination, and therefore we do recommend that a breast ultrasound at that age, and then from the age of 50 having a routine mammogram, as well as self-breast examination and a doctor's examination.
But it's never too early. Even if you're in your 20s or 30s, you still should be learning, which she's going to show us just in a moment. Now, you've told us what the risk factors are, and some of them we can't do anything about if it's genetics, for instance. But what are some of the things that we can do, some preventative measures, foods, lifestyle changes we can make that can help prevent us from getting the disease?
Now, I must emphasize that you may not prevent yourself from getting breast cancer.
Yeah.
And the most important thing is to find it.
Right.
Having said that, living a healthy lifestyle, for example, you know, we do tell people to eat right, to keep your weight down, to exercise, not to smoke, reduction or moderate or no intake of alcohol are all contributory to either preventing your cancer risk or, you know, making sure that you're healthy when a diagnosis is made, because healthier patients tolerate treatments better and usually tend to have a better outcome. Because if you're fit, you exercise, your cholesterol is good, your heart is good, you're more likely to tolerate the treatments that we offer. So generally keeping healthy has many advantages, including ability to tolerate treatment, and also people who are very conscious about their health are likely to pick their breast cancer early. I must say an early diagnosis makes it very cost effective and life-saving to treat breast cancer.
Ooh, and on that note, I think it's time for us to learn how exactly to do it. And I see you've got a chart there. Okay, so we're now standing in front of the breast self-examination chart, and you were also explaining earlier that the key thing is to be able to detect it as early as possible. Hence the reason we also want to know how to do that. So what are the basics? Can you take us through the steps of a self-examination?
Yes, I can. Now, it's very important for a woman to know her breasts and to choose an appropriate time once every month, preferably after her periods, where the premenstrual tension in the breast eases and they become a little softer, and it's easier to feel any new lumps. Now, once you're very familiar with your breasts, it's very easy to pick differences month to month. Now, the first stage should actually be to stand in front of a mirror and to look at both breasts with your hands by your side. And so some of the things straight, hands on your side, looking at the mirror, and this you're looking for symmetry in the breasts. You're looking to see if there are any unusual color changes, whether there is any retraction of the nipple, whether there is any dimpling of the skin, or any differences between the right and left breast. We also look for swellings under the arm, any differences in your arm size, and also very importantly for the level of the nipple.
So that
they should be at the same level. Yes.
Right.
Because sometimes if you have a swelling that retracts the breast, then the nipple will probably be at a lower or higher level than its counterpart on the other side. Yes.
So for step one, you stand hands straight.
Yes.
What
then for step two, you put your arms akimbo, and what it does, it creates some tension around the chest wall and raises the breast. And observe for the same things. Are there any changes in the level of the nipple? Are there any obvious swellings? Is there any swelling under the arm?
Right, under the arm meaning?
At the armpit.
Armpit.
Yeah, and sometimes our breast extends to the armpit or axilla, and we call that the breast tail, the tail of the breast.
Here.
Yes, so some breast cancers may come from the tail and therefore manifest as swellings in the armpit. And it's important to look at that as well. Breast cancer can spread to the lymph nodes, so the other swellings that you're looking for with your arms akimbo should be around your collarbone, around your armpit area, probably the middle of the chest as well, because some cancer manifests as swelling of the lymph nodes.
So it's not just to check what's happening here, but
everywhere around here. Including, as I'd mentioned, color changes. Some breasts, as you stand akimbo, the placaring or the retraction of the nipple may become more obvious. Sometimes a swelling may cause the skin to retract and dimple, and you can be able to observe that when you put your arms akimbo. Little movements like tightening your chest and probably bearing it forward may also cause manifestations of swellings in the breast. The next thing to do is to raise your arms up round the back of the head, and what happens, you're raising the breasts further, and sometimes the change of the level of the nipple may tell you that one breast has a swelling that is holding it back, that the other doesn't. Subtle changes like swellings on the underside of the breast may be noticed, and more importantly, swellings, as I said, under the arm, the armpit, the collarbone, and probably even differences in the size of the arm, because breast cancer can cause lymphatic obstruction and cause probably swelling, or what we call lymphedema on one arm.
Right. So to also pay attention to the arm, not just even here. Okay.
Yes.
So
now, some women, as you move, hold your arms akimbo, lift them above your head. You may draw your attention to pain, because when you move, when you're moving day to day, you have no discomfort and no pain. But when you make those movements, certain things are drawn to your attention that you felt, oops, the muscle there seems to be a little tense, and when you come to examining, you actually find the lump. So the next stage is actually to stand with your hand behind your head, and take your right hand and be able to feel your left breast. And you massage it around the 4 quadrants. We talk about, if you divide your breast into 4, there is the upper inner quadrant, the upper outer quadrant, the lower inner quadrant, and the lower outer quadrant. Now, in that fourth division, just palpate your breast. Many women say that it is easier when they are taking a shower, and as they soap themselves, they can be able to feel the lumps easier. Now, remember to extend the feeling to the collarbone and also to under the arm and in between the breasts.
So left arm,
yes,
up, right arm touches.
Yes, exactly.
Right arm, left arm.
And on the other side. Now, the next thing you do is place a pillow probably behind the left, your left shoulder. Lie down and put your left arm behind your head, and use your right arm now to palpate the breast as you lie back.
Wait, place the pillow where?
Behind your left shoulder, for example.
Left shoulder.
So you elevate it a little bit. You elevate your breast, and then take your arm and put it behind your head, which puts the breast tissue smack on the anterior chest wall, and then use your right arm to palpate the breast as you lie down. And do that for the other side, and feel for any swellings, any areas of tenderness, any swellings at the collarbone and the armpit, any discomfort that you may get from the arm, and anything you pick, any variation month to month, is very important to see your doctor.
That's very thorough. I think that's as thorough as it gets. Now, I've heard of so many rumors or theories on what causes breast cancer. Some of it has been deodorants, others has been microwaves, others has been contraceptives. What are the myths there and what are the truths?
I try to caution patients that the causes of breast cancer, we try to concentrate on what is evidence-based, because anecdotal things or chance happenings may not apply to individuals across the board. So other than the risk factors I spoke about, many people think that breast cancer is a curse, breast cancer is bad luck, breast cancer only happens to women and not to men. 2% of breast cancer in Kenya is actually in men. And one of the myths that I find very, very hard to beat in our society is what I call dietary myths. There are people who think that if I never eat meat and I don't drink milk, I'll never get breast cancer.
Those two things?
Yes,
meat
those
and milk.
Are very, there is a myth that goes round that if people don't eat meat, red meat especially, and they don't drink milk, they reduce their risk of breast cancer. And that is not necessarily true. And sometimes if we draw attention to groups, for example, in Asia, where people are pure vegetarians, you'd think that their cancer risk or breast cancer risks are lower, but this is not so.
Hey, there you go. What about the deodorant one?
The deodorant, no deodorants have been known to cause breast cancer.
Really?
None whatsoever. Use of microwaves, use of paper bags, and so on, and the myths go on and on.
Contraceptives?
Contraceptives do have a documented risk in breast cancer, though the risk may be small,
Yeah.
what happens is that individuals may have another risk. For example, they have a genetic mutation they don't know about, they have a strong family history, they've had a previous breast cancer, and in those groups probably the use of oral or hormonal contraceptives should be discouraged.
Yeah. Wow. Okay. Well, we have come to the end of this show, but I want you to leave us with what you know for sure from having been an oncologist for many, many, many years, having treated so many patients. What is it that you wish more women and men and families knew about this disease?
Probably the most important take-home message is that I may not reduce my individual risk of getting breast cancer, but I can find it early. And early diagnosis of breast cancer especially can be life-saving and saves you a lot of cost as far as the treatments go.
Yes. Wow. Okay, there you have it, early detection. So again, October being Breast Cancer Awareness Month, now is the time you want to go in and see someone and have them check you and make sure that everything is fine. Prevention is always better than cure. Or early detection in this case. It could be the difference between life and death.
And you make a good point. A healthy lifestyle is very important, not only for cancer prevention, but also for the other non-communicable diseases like diabetes and hypertension. And being fit and healthy can also make you tolerate treatment much better. And therefore give you a better outcome.
Okay, thank you, Dr. Kiarie.
Thank you very much.
Now for today's throwback, we're taking it all the way back to the type of cameras used in the 60s and the 70s and looking at how far photo quality has advanced since then. Crazy, right? The difference. But at the same time, there's also something beautiful about those aged photos. But Instagram wouldn't be the same if we still use those old cameras, right? Anyway, thank you guys for watching. Take care of yourselves, and we will be back tomorrow 8 a.m. So I'll see you here, right? Bye, everybody.